All right, good evening, everyone, and welcome. My name is Mark Mamagonian. I'm the Director of Academic Affairs at the National Association for Armenian Studies and Research. I want to acknowledge and thank, first of all, the co-sponsors of tonight's program, namely the Armenian Center at Columbia University, Columbia University Vagelos College of Physicians and Surgeons, the Programs in Global Health, Columbia University Middle Eastern, South Asian, and African Studies, MISAS, the Institute for the Study of Human Rights at Columbia, and the Nasser Kalust Gulbenkian Foundation series on contemporary Armenian issues. I want to announce also that next Thursday, a week from tonight, December 10th, there will be another program which is part of the ongoing collaboration of Nasser and the Armenian Center at Columbia University. And this will be a lecture by Dr. Arasanjan of the University of Michigan, Dearborn, entitled The Armenian Church in Nagorno-Karabakh, Artsakh in Modern Times. And I would encourage you to join us for what will be an informative and relevant presentation by a highly knowledgeable speaker. In the program we have tonight, we will hear from 3 speakers on the evening's topic of conflict, displacement, and COVID-19, with a particular focus on the Middle East, Africa, and the South Caucasus. We will be taking questions via the Zoom Q&A feature only, which I see at least 2 people have already found. So please submit preferably succinct questions there, and we will try to address as many as time permits following the 3 speakers' presentations. Our first speaker tonight is Dr. Khachig Muradian, who is lecturer in Middle Eastern, South Asian, and African Studies at Columbia University, where he also leads the Armenian Studies program. He is the author of the forthcoming book, The Resistance Network, The Armenian Genocide and Humanitarianism in Ottoman Syria, 1915 to 1918, to be published by Michigan State University Press next year. Khachig has published articles on mass violence, concentration camps, unarmed resistance, and approaches to teaching history, and he serves as the editor of the peer-reviewed journal, The Armenian Review. So we will now ask Khachig to unhide himself, and we offer him the podium.
Thank you, Mark. Thank you for the introduction, and thank you for your ongoing collaboration, Nasser's ongoing collaboration with the Armenian Center at Columbia. Today, I'm going to be offering introductory remarks before my 2 colleagues focus on their respective cases, which are Armenia and Ethiopia. So let's start. As the 1918 influenza pandemic raged, Joshua Bryan Lee, a private in the US Army who served in France during World War I, wrote a chilling poem about the devastation he witnessed. And I'll be quoting a portion of it. It stalked into camp when the day was damp and chilly and cold. It crept by the guards and murdered my pards with a hand that was clammy and bony and bold. And its breath was icy and moldy and dank, and it killed so speedy and gloatingly greedy that it took away men from each company rank. With demonish gloat inflaming the throat and cramping the back, a sickening pain, a feverish brain, and the soldier went away without his pack, end quote. Private Joshua Lee's words capture the horrors at the intersection of war and disease, the topic of our discussion this evening. This intersection of natural and man-made disasters has manifested itself in multiple ways. Epidemics and pandemics have triggered wars, served as cover for wars, been weaponized during wars, decided the outcome of wars, and brought wars to a halt. Take, for instance, the Great Plague of Athens, or the Athenian Plague in 430 BCE, which led to the defeat of the city-state in the Peloponnesian War, spelled the end of the city-state's golden age, and contributed to the decline of Athenian democracy. Many centuries later, in 1345 CE, as Kipchak Khan Janibeg's army besieged the Genoese port of Kaffa, modern-day Feodosia in the Ukraine, he used a plague that was sowing death among his soldiers as a weapon, catapulting dead bodies into the besieged city to spread disease among his enemies. This has been referred to by scholars as an early, and I'm quoting here, an apparently highly effective form of germ warfare, end quote. Other scholars refer to it as the first case of biological warfare, which spread the disease from Kaffa in Crimea to regions across Europe. It's worth noting here that the siege ended within a year because of the spread of the disease, in the army. Yet the damage was done. So I'd like to quote here from a writing, from a text translated by a local who witnessed and wrote about the siege and the way in which it spread the disease. And here we go. The dying Tartars, stunned and stupefied by the immensity of the disaster brought about by the disease, and realizing that they had no hope of escape, lost interest in the siege. But they ordered corpses to be placed in catapults and lobbed into the city in the hope that the intolerable stench would kill everyone inside. And again, I'm quoting here. What seemed like mountains of dead were thrown into the city, and the Christians could not hide or flee or escape from them, although they dumped as many of the bodies as they could in the sea. And soon the rotting corpses tainted the air and poisoned the water supply, and the stench was so overwhelming that hardly one in several thousand was in a position to flee the remains of the Tartar army. Moreover, one infected man could carry the poison to others and infect people and places with the disease by look alone. No one knew or could discover a means of defense, end quote. Moving to the early 20th century, in my own work, I argue that epidemics had a significant impact on the policy towards Armenian deportees in the Ottoman Empire during the Armenian Genocide, as World War I was raging. Several key orders associated with accelerating the redeportation of Armenians in the fall of 1915 were taken as the scourge of typhus loomed large in Ottoman Syria, a development that German and soon thereafter Ottoman command considered a problem that required immediate attention. As the authorities tried to avert a crisis that threatened military supply lines, they also weaponized disease, isolating Armenians in the repositories of typhus and dysentery concentration camps. Having dealt with Muslim refugees pouring in from the Russian Empire and from European territories it had lost, the Ottomans had significant experience with epidemics and were well aware of the devastation communicable diseases would cause in camps deprived of basic supplies and medical care. The Ottoman authorities realized that they could turn the specter of typhus haunting Syria during World War I into a weapon of genocide if they separated the Armenian deportees from the general population and sent them away to die alone. For example, in a telegram, Minister of Interior Talat Pasha informed the head of the Directorate for the Settlement of Tribes and Immigrants, Shukr Bey, that typhus and dysentery were killing 70 to 80 people a day among the 20,000 deportees in Hama, and ordered that they be redeported as soon as possible. Now, when COVID-19 began spreading around the world earlier this year, the global community tried to prevent new iterations of the war and disease historically lethal combination. UN Secretary General Antonio Manuel de Oliveira Guterres issued an appeal for a global ceasefire as early as the 23rd of March of this year. In June, 170 member states and observers issued a non-binding resolution statement on a global ceasefire, again, following and based on the earlier March statement. And within weeks, the United Nations Security Council adopted Resolution 2532, demanding, and I quote, "a general and immediate cessation of hostilities in all situations" on its agenda, end quote, and called upon, I'm quoting again, "all parties to armed conflicts to engage immediately in a durable humanitarian pause for at least 90 consecutive days," end quote. Now, a global ceasefire was far from achieved. In fact, a good place to follow, to observe developments in terms of the global ceasefire and how it is being observed is a website which I will share with you right now. It's quite helpful as it combines data on coronavirus cases and deaths, as well as cases of ceasefire, whether they're unilateral cases of ceasefire, bilateral cases of ceasefire, multilateral cases of ceasefire, and then the reporting and news related to it. Now the website is not perfect. Those of you who are familiar, particularly intimately familiar with some of these cases, will notice that there are certain discrepancies, there are certain delays in posting some of the developments. In the case of Armenia and Azerbaijan, for example, just up until a couple of days ago, at least, there was no reference to the agreement that was signed between Armenia and Azerbaijan, the leaders of Armenia, Azerbaijan, and Russia. So, however, overall, this is a very useful tool and resource to look at this intersection between COVID-19 and conflict and the attempts to essentially bring about a ceasefire. So the global ceasefire was far from achieved. Conflict and war have continued in places such as Yemen and Libya, and wars have erupted in the South Caucasus and Africa. On September 27, Azerbaijan, which had not signed the ceasefire agreement that I mentioned earlier by the UN, launched a large-scale war against Nagorno-Karabakh, Artsakh, as a result of which thousands have died, tens of thousands displaced. After two failed ceasefire attempts, the leaders of Armenia and Azerbaijan signed an agreement ending hostilities. In northern Ethiopia, the coronavirus, as Dr. Firu will argue in her lecture tonight, and I'm quoting here, added fuel to the fire, end quote, of the conflict, triggering military confrontation. In tonight's event, we will examine these two cases in particular, one in which the pandemic served as cover to start a war, and the other in which it triggered one. Thank you.
Thanks, Kachik. Thank you very much. And we will now hear from our second speaker. Zion Firu is an emergency physician and assistant professor of emergency medicine at Columbia University in New York, and an advisor to the Ministry of Health for the Federal Democratic Republic of Ethiopia. In her role at the ministry, she supports and oversees several programs, including emergency care capacity building through training and research, emergency preparedness, and the response of Ethiopia's Public Health Institute to mobilize resources with initiatives to assist in the attainment of Ethiopia's health sector transformation plan. Now, Zion has recorded her presentation, which we will now be watching, because she is in fact currently in Ethiopia where she's been called to duty in her official capacity as a result of the current human rights and health disaster occurring there. And we hope that she may be able to join us during the Q&A, but owing to the uncertainties of internet and the difference in time, we're not certain that will happen, but we'll hope for the best. We'll also hope for the best now as I attempt to share the video on screen here.
Thank you guys for having me here today. And unfortunately, I couldn't be there live, so I'm going to share most of I'm going to share this before boarding a plane, and I'm sorry I couldn't be there in person. And I appreciate Dr. Heckman also helping me with changing the slides since I couldn't share it from my computer at this point. So for the next 10 minutes or so, I'm going to give you a bit of a glimpse of what's been happening in Ethiopia with the COVID response and the recent conflict that we're seeing in Ethiopia. I have to put a complete disclosure here because I work for the government of Ethiopia at the Ministry of Health, but I just want to put it out there that I'm going to put my academician hat at Columbia University, and most of my discussion point is going to be very neutral and approaching it in a way from an academician side. So hopefully you guys will understand. Ethiopia, next, can we start with the next slide? Thank you. So Ethiopia is a country in East Africa with a population approximately of 115 million. That's an approximated population because the last time we had a census was over 10 years ago. So based on the estimate, we're thinking that approximately we have around 115 million. Next slide. So in Ethiopia, we call Ethiopia the country of two extremes. We have the mountains area that go up to 4,500 and 5,000 meters, which are the highest point. And then you have the volcanoes, which are active volcanoes, lava, and the Danakil depressions that are in 100 to 150 meter deep below the sea level. So there are many, many different natural sites and great, especially you'll see a lot of historical church and things, which I'm not going to get into, but hopefully at some point in your life you'll be able to visit. Next slide. And along with Ethiopia's many years of history comes with close to over 80 different nationalities and languages that are spoken in Ethiopia. And this is comprised of different ethnic groups. And in the past few years, next slide, the government, as of 1992, the new government changed the whole administrative regions and replaced the province of Ethiopia under this formalized along the ethno-linguistic regional states. And these are divided into 9 regional states and 5 cities. And so Ethiopia is a government structure and a federation of 9 regions. And the reasons that I mentioned that is because some of the conflicts that we witnessed in the past few years has pretty much been because of this national division amongst the regions. And in the past 2 years, the new prime minister was trying to find a way to go away from that system of governance. But for the past 27 years, this is how the country has been led. And just to give you a little bit of perspective, Ethiopia's most of the population are people that belong to the Oromo tribe. And in the past few months since COVID and became a pandemic and Ethiopia had the first case in March, I'm going to kind of share some of the conflict and recently the war between one of the regions and the central government, how that has unfortunately led to the spike in cases. So next slide. One big conflict happened in Ethiopia back in July when a very known singer that comes from the ethnic Oromo group, whose songs he's seen as this figure of the movements of the Oromo people. And unfortunately, he was killed in the middle of the state of emergency that was placed due to COVID. That led to a lot of riot in the city and also in the different regions where his burial was supposed to take place. Unfortunately, most places in Ethiopia had been shut down because of the mass gatherings and anything that involves the people traveling en masse had been stopped due to COVID. But during this, during his death, it just led to lots of people gathering, and at the same time, unfortunately, the mask mandates and all the other mandates that were being implemented were thrown out of the window. So next slide. As you see, the incident that you see around the beginning of July is when he was killed. And as you see right after that, you can see the case doubling. And just to let you know, so the purple line is the number of tests that they're doing, which is recorded by the Ethiopian government. As you see, sometimes the privates and other institutions, if they do it as the tally, the numbers do not really add up. But if you look at this number, so it was less than 200, 300 a day. But after this incident and after the protests and this what we call super spreader event, you can see the cases grew very exponentially. And one thing also to add, the cases, the number of testing that we're doing between July and August were the same as what we're doing in June, as you can see, but still the cases had gone up a lot more between July and August. And then in August, there was a combat, which is what the government instituted to test at least 15,000 people per day. And of course, the more testing you do, the more cases you'll see. But the positivity rate did not change for most of August. But before the incident and after the incident, you can see a clear demarcation and the increase of the positivity rate. And this has contributed to there were many mass gatherings and that we suspect also that became a super spreader event. Some of you guys might know COVID hasn't really hit Africa the way we had expected it, mostly because most of the cases especially had been asymptomatic patients. And also one of the biggest contributor that we see that we're seeing a lot less deaths in Africa is, of course, it's different from countries to countries, but as a general rule of thumb, I think it's the demographic. Africa, especially in places like in Ethiopia, most of the demographic, close to 70% of the population is under the age of 35. So as we've seen, the mortality after the age of, for those people after the age of 70 and 85 is much higher than you see in the States and in Europe. But young people, mortality is much lower all over the world. And because of the because of the variation in the demographic of the population in Ethiopia and most of sub-Saharan Africa, we've seen that the COVID has not killed or has affected that many people when you look at the percentages across the continent. Next slide. In the past few weeks, as some of you guys might have seen in the news, unfortunately, on the day of the US election, a big conflict started in Ethiopia between the central government and the regional ruling party in the Tigray regions. Though we don't have that many data how it has affected COVID, something that we can tell you a few things are the number of testings and people, the reports of any health, any humanitarian or health services had completely stopped and halted. That's because the government, when they were going to this war and the conflict, they shut down the internet connection or any sort of transportation and commerce. So for the past few weeks until now, we still don't know what's happening at most of the health facilities, and at the same time also how COVID has spread. But as many pictures are showing us all over, people, of course, during war are not wearing masks. The people that are going from one region to another, or some of the refugees that have been crossing to Sudan, we're seeing that they're not wearing their mask, and of course, people are congregated together. So there's a lot of fear that the numbers might spike in that region. Next slide. And one of the things I would want to say, what has happened in Ethiopia and how this specific conflict that's happening between the Ethiopian government and also the regional government is because of an election. First of all, I really can't say just only because of the election, but mostly it's because of a conflict that had stayed for the past 2 years since the new prime minister who won the Nobel Peace Prize last year took power. But one thing that really added fuel to the fire is COVID. So Ethiopia was supposed to have the election in August, but because of the pandemic, the central government decided to postpone the election. And at that point, the regional government, one of the regional governments, decided that the central government is not constitutional, that they didn't have the right to postpone because of the pandemic. So that really offset this current war. And as you can see in the slide, when the regional government decided to go in defiance of the prime minister and held the election, you can see people are wearing their masks and they have some sort of physical distancing. And this happened back in September. Next slide. So in this region, where we're seeing in Tigray is where right now the war is occurring. As of 2 days ago, the central government had stated that they've gotten rid of this political party that is instigating the war. And what's set off the conflict, which I forgot to mention 2 slides ago, is on the night of the election, the regional government decided to take this Northern Army and that region and started fighting and also holding some of the central government military personnel. So this happened on the night of the election in the USA. So this was away from when everybody was distracted, the whole world was distracted by the US election. And unfortunately, since then, most of the humanitarian efforts, commerce, even electricity was stopped for about a week. And still phone, any sort of communications had completely stopped. So people that have family members there have not been able to know if their families are okay or have survived. Also at the same time, the casualty numbers are still unknown. Most of the information has come out of the central government, which a lot of international organizations like Amnesty and UNHCR have been questioning. Next slide. And at the same time, you see a lot of refugees fleeing to Sudan, to a neighboring country, looking for shelter. And you're seeing people are being transported from Tigray region to Sudan in crowded boats with no mask on. So at this time, everything that we had instituted for the past few months about wearing masks and physical distancing, which people were doing very well the first few months, unfortunately could not uphold during the war, because when people are looking for a shelter and trying to save themselves and their family members from dying, those things unfortunately go out of the window. The next slide. It's just we're seeing more and more mass displacement, and the UNHCR has asked for more help for the refugees in Sudan. And some things that we've also seen, next slide, as most of you guys know, Dr. Tedros, who is the Director General of WHO, unfortunately had been accused by the military chief that he is supporting the regional government, which he used to be part of before he joined WHO. And at this point, there are a lot of claims, and of course, the army chief didn't have any evidence for that. And Dr. Tedros had shared and released a statement saying that that these reports are untrue and that he's taking the side of peace, not taking the side of the government or the regional government. And unfortunately, this is something that comes during wars. There will be a lot of blaming. And this is something that also is coming out of this war and also affecting his work at WHO. As you can imagine, there are a lot of media and questioning about what his role is or was. The next slide kind of want to show how, so the last slide, on the night of the election, you can see at 3 o'clock after finishing my shift in the emergency department, and two places that I call home, Ethiopia and America, I felt very, I felt in despair. I felt very overwhelmed with what was going on in those two places. One country was on the brink of a civil war, and in the U.S., how COVID had actually led to most people voting through mail-in ballots, and how most of the election results had been contested. And that night, you can see the polarization and people really, the ugly side coming out. So that night, I really reflected how COVID had impacted the political stability of two places that I call home. One is in Ethiopia and also one in America. So I think we're probably going to see whether we have vaccinations and all these things available to fight COVID. I think in the next few months to years, we're going to see the aftermath of COVID, which I call the COVID math, and it's going to affect the livelihood, the political stability of many, many places as the UK and the USA takes away most of their aid money for local support. Most places are going to be in despair. So I think COVID is going to have a lot of effect down the line, and we really have to be cognizant of some of the outcomes. And most of you guys as students, as people in healthcare, I think we're going to be witnessing it. And I think that's why health really matters. It should be the priority, and also should be given for most politicians. It should be given a priority whenever they have any sort of political decision or any major decisions. That's it, and thank you so much for having me, and I'm sorry I couldn't be there live.
Okay, I think that worked. All right, the video, and we're certainly appreciative of Sion for doing that before she left for her homeland of Ethiopia. So our final speaker is Kim Hakimian. Kim Hakimian, PhD, is Assistant Professor of Nutrition in Pediatrics and the Institute of Human Nutrition at Columbia University. She teaches public health nutrition, survey research, qualitative methods, and research methods. And she is also the Associate Director of Education for the Program for Global and Population Health at the Vagelos College of Physicians and Surgeons, and was recently the Associate Director of the Medical Nutrition Program for Health Professionals at the Institute of Human Nutrition. She also, I should add, serves on the board of the Armenian Center at Columbia University, and we're very happy to have her tonight to speak. We can get Kim to show her video. There we go. Excellent. Oops, sorry.
Thank you very much, Mark. I appreciate it. And thank you for helping with tonight's event. I'm going to share slides and basically give a continuation of what Dr. Farouk was talking about, this intersectionality between COVID and war and COVID, but talking and focusing on the situation in Armenia. So again, I'm going to be speaking and focusing on Armenia's skyrocketing cases of COVID as a result of the conflict with Azerbaijan and Turkey. I first would like to make a disclosure that I am of Armenian descent, and I started my career living and working in Armenia at the American University of Armenia. And so a lot of my perspective comes from that formative experience. I'm going to set the stage tonight and talk a little bit about the start of the war, which was on September 27. And we're going to be looking at Armenia's COVID experience pre September 27th and then thereafter, so pre-post. We'll look at the consequences and the causes of this exponential spike in cases and finish off with the situation today. Before I dive into Armenia, I do need to remind the audience, not because you don't know, but remember what are the key means of prevention of COVID-19. Think of these behaviors of mask wearing, physical distancing, frequent hand washing, and understand how difficult these behaviors would be in times of war, conflict, and displacement. And as Dr. Farouk mentioned in her talk previously, these are the types of behaviors that are nearly impossible to expect people to adhere to during these unprecedented and tremendously difficult times. For the audience that is not Armenian on this call today, I will just show you where is Armenia. It's in the Caucasus region. It lies to the east of Turkey, to the west of Azerbaijan, north of Iran, and south of the Republic of Georgia, which is south of Russia. And here on the right, I'll show with this map here that this region where the war broke out here is a region that Armenians call Artsakh, and but is otherwise known and was known during the Soviet Union as Nagorno-Karabakh. And Nagorno-Karabakh is in this region here with the lines. These are lands that have been historically populated by Armenians, and for reasons that I cannot get into in tonight's talk, were administered by the Soviet Republic of Azerbaijan. And when the Soviet Union fell, these lands were fought over between Armenia and Azerbaijan and remained in Armenian control from the 1990s early on until the war here of 2020. So I start this story with a picture, and as you know, photos do tell stories. This is a photograph that took place soon after the war started. The war started again on September 27th. And this is a photograph of volunteers who are volunteering to join their brethren at the front to fight for their lands and their security. I apologize in advance to anybody who may know people in this photo. I've tried to be very careful about selecting photos. I do not know what happened in the end to these men, and I pass my sincere condolences if for whatever reason these men have not had a good outcome, and I want to be cognizant of that as we move through the talk. This photo, however, did engender quite a bit of heartwarming reaction in the diaspora and through social media, because it showed the level of unity, the level of energy, unity, and brotherhood, which was a part and parcel of the energies of the beginning of the war. And it was a show of solidarity. And yet the public health people amongst us, many of you are probably on this call, we gasped when we saw this kind of photograph going around on social media, because we were quite certain that if there was one person on this bus, the bus filled with people, the windows closed, a long trip south, we were pretty sure that if there was one person that was COVID positive, that this would be disastrous for the spread of the infection at such a vulnerable time in Armenia's history. In addition to the mobilization of troops and volunteers, there was also mobilization of donations. And so this is a photograph of students in the capital city of Yerevan, and they are mobilizing within one day, actually I think this was the day after the war started, to put together food packages, supplies, to send them down to the front to support the volunteers who had gone down as well. And this type of mobilization for donor centers grew throughout the country. And this is another set of photographs looking at mobilization of people who are supporting the war effort by gathering to make important supplies. This is women who are making a camouflage net, and then women making parts for the uniforms. And what I want to show here is that these are in indoor, no ventilation. I believe that the photograph on the right is in a basement, and very little mask wearing or physical distance. Very, very early on, there was bombing of civilian homes. and apartment buildings in the capital of Artsakh, which is Stepanakert. And these are two photographs among many that you can find online about the kinds of bomb shelters where people were living because it was no longer safe for them to be in their homes. And again, there's no ventilation, no physical distancing, and not surprisingly, quite a few people became sick with COVID-19 as a result of staying in the bomb shelters. Funerals were another source of clusters of the infection. And again, I will show you that the funerals are very emotional and packed with people. And again, quite varied abilities of people to wear masks and so on, another source of cluster infections. So what are these type of exposures? What did they lead to? What does the data show? These are data from Armenia, which look at the 7-day rolling average and also the positivity rate. And as you can see from August, Armenia, I'm going to show you in one slide what happened before August, but Armenia had already come down and had flattened its curve from its previous surge, which had happened in June and July. And by mid-September had gotten down to somewhere under 200 cases as a 7-day rolling average. But by the time then here, the war started right here. And then you can see that within a few weeks of the start of the war, you can see this incredible increase in cases, mirrored as well by the positivity rate of cases. And what happened prior to then, this is the first surge in Armenia. Armenia's first case was detected in March. And the first surge really occurred after Armenia came out of lockdown and business resumed. And essentially the beginnings of the first surge occurred here. So I'm showing you this particular graph to show you the differential, right, between what we thought was really Armenia's largest spike and surge and the difference of what happened after the war. This is a graph from Our World in Data, which shows a daily new confirmed COVID deaths per million population. And so I only put Armenia in here. You can see, again, these are daily new confirmed deaths. And this is from September 27 to November 6. You can see the spike over the course of those 5 or 6 weeks. You can see the spike in deaths from COVID as well. And this is the last graph at the moment. So thank you for those of you who are not in the field. This is a graph which also looks from Armenia's data. And this is a 7-day average of total number of deaths, 7-day average. So this is per day. And you can see that the average before the start of the war here with my cursor was 2 or 3 COVID deaths per day. This has gone up to, at this point today, and I believe yesterday, in fact, there were 35 COVID deaths recorded yesterday. So you can see again that that surge rate and the results of the spread of the infection. So what are some of the other consequences of the conflict and COVID-19 intersection? Military capacity was absolutely compromised by COVID-19 after the forced ceasefire and in the speeches that were given to describe what happened during this crushing defeat. Both the Prime Minister and the President of Artsakh discussed in detail how soldiers were infected. And then in fact, throughout the system in Artsakh, they were infected with COVID-19 and that this impacted their capacity. Hospital capacity has been severely impacted by this surge. There's been a shortage of beds and a shortage of healthcare workers. Healthcare workers who are working in infectious disease have been absolutely burned out by the surge that happened in the summer and then this spike as well. Many clinics and clinical settings found that the entirety of their healthcare worker staff was sick with with COVID as well. The other result has been a depletion of oxygen and essential supplies that are needed to support those who are sick. And this lack of oxygen has been an issue that has led as well to some of the death numbers that you saw in the graph previously. And the intersection between conflict and COVID has absolutely exacerbated what is a catastrophic set of humanitarian needs in the region. The wounded soldiers and civilians have their own unique needs and place stress on the medical system, the needs of the displaced people from the conflict, and the stress on the health systems as well. There has been international recognition about the situation of COVID and conflict in Armenia. The World Health Organization put out a statement about this, the surge of COVID being a direct result of the conflict. And this is a comment in the Lancet Global Health about war in the time of COVID-19 and the humanitarian catastrophe in Artsakh, Nagorno-Karabakh, and Armenia. So this came out on November 23rd, about a week ago, and this headline says, Corona cases again fall in Armenia, which is true, and you saw that in the graph as well. But I want to caution everybody on the call and those who are watching the video later on in Armenia that the cases are still quite high, very high. And the quote that I'm pulling out from the article says, according to the ministry spokeswoman, the number of infected people waiting hospitalization due to a shortage of hospital beds stood at 321 as of Monday when this article was printed. It hovered between 500 and 600 earlier this month. So that means 500 to 600 people per day were waiting to get into a hospital bed as a result of their COVID-19 infection and were unable to do so because the capacity had been surpassed. So what is happening today? One of the biggest issues today is the displaced people from the areas of Nagorno-Karabakh. And this is a photograph taken actually of people who are returning to Stepanakert, having fled it earlier. And they are returning and very emotional, and they have their bags and they're getting off their bus, or they're getting, on their bus, and they're greeting each other. And again, these are perfect opportunities for the spread of infection. And as you can see as well, among a group of probably vulnerable people by their ages. And why are there displaced people, so many displaced people? Again, this is not in my wheelhouse, but it's important to show that all of this territory that had been under the control and populated by Armenians since the 1990s for 30 years, the only amount remaining where Armenians will be allowed to repopulate or return to, I should say, is in this pink area here. And these are regions where Armenians that were living in these regions will have to leave them and live elsewhere. Either they will be displaced in the region of Artsakh, or they will remain living in Armenia and be displaced there. So this is a very vulnerable population, vulnerable for a lot of reasons, including vulnerable to the ravages of COVID-19. In addition to which, the Armenians who will be returning to Artsakh are returning to an area with terrible infrastructure, issues of water and electricity, but in particular issues of healthcare infrastructure. This is a photograph of a hospital in Stepanakert that was bombed during the war. And these types of infrastructures will be needed if there is a surge among Armenians living in Artsakh, if there's a surge in COVID cases, which is entirely expected. Those who are displaced, many of them are living in shelters for refugees, where again, it's nearly impossible to socially distance. And there are questions about whether there's regular opportunities for running water and soap, and the use of masks when you are undergoing such an emotional change, in your life is one that I think really prevents people from being able to think about preventing COVID-19. And so it leads to my last few slides, which is that grief is, I think, a determinant of health, and the entire nation is grieving this loss. This is a photograph of a cemetery where there are soldiers buried, but the grief goes even beyond the loss of life. It goes to the loss of land, to the loss of important cultural monuments and churches, and it goes to a loss of security, and has led to a lot of civil unrest in the country. There's an incredible amount of instability. And so as a result of that, these are a national grief. This leads to a national grief, which will also be impacting people's health and making people more vulnerable to the consequences of COVID-19. Now, some would argue that, these cases are going up around the world. And so I do share with you a snapshot, a global snapshot, again, our world in data. And this shows you, of course, that the Armenian region and much of the world is in this sort of red and hotspot areas. And I'll just take out the countries that are in the same sort of spike also do happen to be in the region, of course, with the United States as well. But I would argue that Armenia simply didn't have a chance. They had a better opportunity with enforcement to keep their numbers low as they had brought them down in September. But because of the war and the opportunities for this transmission, they really didn't have a chance to be in these lower color categories. And so finally, this is my last slide. I just would like to say that I thank all of the heroes in this story that have been fighting on the front line, soldiers who have fought for the land and for the nation, and healthcare workers who have fought equally hard for the survival of their patients. And these are really the heroes of this story. And it is incumbent upon the international community, the academic community, and the donor community to support both of these heroes moving forward. Thank you.
Kim, thank you so much. It's just, it's overwhelming in each of these presentations to think of the misery that's been caused by these conflicts being added to by the diseases and the effects of the pandemic. It's almost too much to process for me, at least. Each thing is by itself too much to process. So I want to invite the audience to submit their questions again in the Zoom Q&A. And I want to start with the question for either of you or both of you about the role that the pandemic played in the war itself, in the timing of the war, I should say. Is it your view that the attack by Azerbaijan in conjunction with Turkey was carried out at this time in part because of the effects of the pandemic, and that Armenia might have been especially vulnerable? I would have asked Sion, frankly, the same question if she were able to participate. But if you have any thoughts on this subject, please share them.
I would say that absolutely COVID played a role in decision making for Azerbaijan and Turkey. And I would say that it is absolutely not coincidence about when they decided to launch their attack regarding COVID and the epidemic. So COVID has been consuming for the world and has consumed much of the world's energies and financial resources. And that is not different than in Armenia. Armenia fought very hard to address their first surge, and it was costly, and it took a lot of time and energy from the government. And I'm sure that there was a calculation made about how much that took away attentions and efforts on other issues. Certainly, it was also a cover, right? That the rest of the world and Europe had already started to experience their increase in numbers. And again, their attention and energies were being spent battling the pandemic. And I believe very strongly that this was also an anticipated consequence of the war as well.
Thank you.
Just a couple of notes here related to both taking advantage of the global distraction, so to speak, and also the vulnerabilities of Armenia in particular that Kim talked about, I think, of course, the role of Turkey here, cannot be overstated. It is a kind of situation where, Turkey has been during this war, during this entire period, it has played it has been the engine of the Azeri war effort. This is not just with the beginning of the war itself. This is over the summer, again, while many of those initiatives for a global ceasefire were already in place, there were military exercises. The Turkish military, the Turkish warplanes were in Azerbaijan engaging in military exercises. There were concerns that there's a lot going on in preparation for an onslaught. In many ways, Ankara has played as Baku's handler, fixer, terrorist whisperer, right? Shipping, hundreds, thousands of mercenaries from Syria and elsewhere. So all of this really add this to the fact that, as historians, when we talk about the Armenian genocide, it is often mentioned that, the Armenian genocide happened under the cover of war, under the cover of World War One. So it's difficult to not make a similar, observation in the context of today, 100 years later, particularly with Turkey being such a critical player in this war, about how another different kind of global war was taken advantage of and used as an opportunity to wage a bloody war in the South Caucasus.
Now, I wonder if you have any information about the impact of the war, the coming together of the war and the pandemic in Azerbaijan. Is there any data available about Azerbaijan, or for that matter, Turkey? Although since Turkey was not engaged on the ground in the same way, it's perhaps a different case.
Yes, so there is a surge in cases in Azerbaijan and Georgia and Turkey in that region. And one of my last slides had a map sort of showing that whole area is sort of painted dark red. The issue with Azerbaijan has been the question of testing, and Azerbaijan and Georgia have not shown data to show that they had a spike or a surge in the beginning. And it would not surprise me if the war mobilization in Azerbaijan also led to an increase. But here I want to stress something, that the case rate in Armenia was higher originally and was on the upswing right at the start of the war. And so Armenia was, unfortunately, had the unique characteristics that led to that sudden, immediate surge. Mm. I can speak on behalf of Dr. Sion Ferru. We spoke before she left. Unfortunately, she has not been able to connect with us at this time, but she indicated that COVID also played a role in the start of the conflict there. And she was describing the interesting parallels about issues with elections and COVID. Here in the United States, there was a push for mail-in ballots, which became somewhat contentious, but the push for mail-in ballots had its genesis had the protection from COVID-19 as part of that. And in Ethiopia, one of the issues that she indicated that led to, or was a trigger for this latest conflict, was in fact the decision to delay elections, again, because of COVID.
We have an interesting question here, again, showing the intertwining of all of these various topics, asking to discuss the impact of COVID denial. That is to say, the belief that COVID is not real or is not serious or is some sort of hoax. It seems like every conversation Khachik and I have, either personally or on Zoom, comes around to denial at one time or another anyway. So how does it work, and how has it particularly affected the people involved in these areas that are under discussion tonight?
Yeah, so this is a topic that, so there is a group of us that meet weekly called the Public Health Working Group for Armenia. And this has been a topic we've discussed since the breakout of the first COVID surge in Armenia. And there is a cultural resistance for sure in Armenia, as there are in every country in the world. Armenia has also been subject to what the WHO has labeled the infodemic regarding this pandemic. There has been some skepticism and resistance. Armenia, however, was able to manage their caseload. So I would say that the skepticism and resistance played a significant role in the original surge, because Armenia was able very early on to identify and quarantine or isolate their early cases of COVID-19. Then they went into lockdown, as did many countries around the world. And they were able to sort of control. And you see that in the data. When Armenia opened up and from the lockdown and loosened the restrictions, within about 14 days of that loosening of the restrictions, you do see a doubling of the numbers of COVID-19 cases. And that was the beginning of the first surge, which really started in the middle of May and peaked. There were two peaks sort of in June and July. The way that they were able to manage that was through enforcement. And this is an important point. So I'm really glad for whoever asked this question, because it was really through the enforcement arm of the government that they made masks mandatory, and that they were able to a certain extent, they were able to restrict public gatherings, social gatherings, weddings and baptisms and so on, which were really one of the major sources of clusters of infection in the country. And what happened with the war was that these enforcement arms and all of the police and anybody who was involved originally in enforcing COVID restrictions was now called up for other duties for the war. And so that was another variable in play. Not that enforcement of masks during this mass mobilization, that probably wouldn't have happened for a number of reasons, but that particular arm was also incapacitated, right? Because their attentions and focuses were elsewhere. Thank you for the question.
Sure.
And there continues to be skepticism today. And I think that some of what we're seeing in this curve coming down is really because people finally, most of the skeptics know somebody, unfortunately, who has probably had a very severe case or has died of COVID, and that may be changing some of their behaviors.
Yes, just a quick note. I am here in New York. We are exposed on a daily, in a daily way to briefings by the governor, Cuomo, who likes saying that denial is not an effective way of fighting against a pandemic. And it is unfortunate that in Armenia and elsewhere, this idea of doubt that we talk about, right, the creation of some kind of doubt is all that is needed in order for people to, put their guard down or buy into many of these arguments. This is true when it comes to, many of the topics that we've talked about, whether it's the tobacco industry, whether it's global warming, right? Any kind of little doubt, and people are happy to just embrace a reality where they can actually walk around without mask and they can go about doing their work and business. I do think also part of it has to do with trusting authority, and in certain environments, countries where for a very long period of time, that kind of trust has not been cultivated and built, that can be an issue. It certainly is an issue here in this country, and has been for a number of reasons in this very contested and environment that has emerged in recent months. So these are crucial factors in that. It is frustrating often to see this, to even see how people are downplaying it. It's the same playbook, right? It's either a hoax, it's either some kind of conspiracy, or it's not as deadly as people think, not as many people have died as, the same kinds of arguments being repeated that we see in other cases of denial as well.
With the same unfortunate effects as well. There's a question here for Kim, I would say, and so Armenia has been under martial law basically since the outbreak of the war in late September. Do you see a chance of a further surge in the coming weeks as some of those restrictions are lifted, or would it be beneficial to impose a strict lockdown to keep this a little bit more under control?
Yeah, I mean, I can't speak to that. It's unlikely that there would be a lockdown for a variety of reasons. And so I can't see that in coming up. What has happened is that there are people who have advocated for policies that would increase mask usage and encourage people to stay at home. But again, with some of the photos and narrative that I showed you, it's incredibly difficult to imagine that cases won't continue to swirl given the sort of perfect storm of interactions that are happening now. And I think that the onus now is on helping the healthcare system to meet that need. And there are a lot of efforts to do so. Luckily, even though I did indicate that it's still quite tenuous and serious, the situation is quite dire, but the people waiting for hospitalization, that number seems to have come down. And so we'll see. I think it's going to be a very dark winter. I think that the more that people on this call who are part of organizations that can encourage that can use their leverage for any type of encouragement of prevention should do so, and should do so consistently and all the time. I think that anybody who is working in Armenia or speaking in Armenia should be modeling by wearing a mask and by enabling those around them to try to do so as well, as hard as that may be. The only way to get these numbers down, is through prevention. And prevention can only happen with behavior. And unfortunately, we're in a situation where that's quite challenging, but not impossible. And Armenia did do it before, but it's a different situation now.
Well, you've touched on one of the other questions, actually, which was what we in the diaspora can do to help. And you've certainly mentioned a couple of things there. Are there other things that can be done? For example, do you know if there are any specific fundraising efforts going on relating to improving Armenia's pandemic response efforts?
Yeah, so I mean, there's a group that is fundraising and looking into building the capacity of the country to be able to provide their own oxygen sources or to expand those and to update them. There are a lot of clinical, I don't think I should spend so much time talking about that. There are a lot of clinical efforts. There are a number of partnerships between the diaspora and Armenia to help improve clinical protocol guidelines, to help improve, again, supply chains. But really at this point, one of the most important things to do for us as a diaspora is to support in everything that we do to support donations for particularly either displaced people or in rebuilding, is to think about ways that we can incorporate prevention tactics there as well. The government, the Ministry of Health, I feel very comfortable in saying that they worked with evidence-based protocols and guidelines early on in the epidemic. There was a surge as a result of, in part, what one of the previous participants' questions was about, for denial and hoax and the infodemic. And it was very, very difficult it was very difficult. And I think that the government expected that people would be more adherent once they opened up and loosened restrictions than they actually were. And then, they managed, again, through enforcement. They had a fining system where they would ticket you if you weren't wearing a mask, which sounds draconian, but really was the only way to start to get those numbers to come down. I don't foresee that I don't see them being in the same position of being able to get that to happen now. And so for that reason, I believe that the cases will remain high for some time to come.
I want to address this question, Mark, because also I think, and certainly Kim is one of those people from the diaspora who's been very much involved. Here at Columbia, there are many others who have been involved in this process, as Kim mentioned, but also we have a number of students, just to give the example of Columbia, who have taken time off this semester and even the next to actually go to Armenia and volunteer and do work there on a number of issues, not just the pandemic, but also the crisis of all the displaced people, the war, and others. So there is this tremendous outpouring of energy and effort to help and assist. And I think that there are many ways to do that. You know, donations are important. There's been many efforts in that regard, whether it's through Armenia Fund, Armenia Relief Society, AGBU, others, but also individual initiatives to assist and help there on the ground, on site, that has been very effective. It is, on the one hand, difficult to see these, the war and the pandemic lining up, but at the same time, it is encouraging and inspiring to see, the generations of diaspora and Armenians joining forces with the people of Armenia to fight on these fronts, particularly through humanitarian efforts.
So there are several questions, and maybe this will be where we wrap it up, that are inquiring about vaccinations as things are getting closer in this country and getting closer in Great Britain. And I believe there is a vaccination program either underway or about to get underway in Russia, or perhaps it's underway already. What can be done to perhaps artificially accelerate the process in Armenia, where obviously there is a very serious need?
Yeah, I mean, Tsion Ferru also mentioned this in her talk as well, that there really is a, with vaccine distribution, there's a sense of giving the highest priority to people who are treating people who have COVID-19, who are the healthcare workers. And then second to that is looking at an equitable allocation of distribution based on vulnerability. And with that second sort of fundamental principle, certainly the people who have been displaced and the people who are most vulnerable for severe outcomes in places like Armenia and Ethiopia should be prioritized for receiving vaccines. This does, however, pull back to the earlier participant's question, which is this idea of the hoax and the denial and the infodemic and disinformation. This is a serious issue in Armenia, as it is around the world. In order for any country's vaccine program to work and be effective for the population, to get us back to pre-COVID normalcy, if you will, not that anything will be normal again in Armenia for some time, but to get us back to not having COVID as a risk, it requires a very high acceptance rate of the vaccine. And I'm not sure about what that will look like in Armenia. There would have to be trust, as Khachik mentioned, the issue of trust. There is a legacy of distrust inherited from Soviet days that has plagued some public health policies in Armenia for some time. There is a role to play for academic institutions in helping governments around the world by doing formative research on what the needs are for these vulnerable populations, who they are, where they're distributed, where they're located, and in what are their thoughts, so that we can create health communications campaigns that really address people's fears and anxieties and distrust to try to improve vaccine acceptance and ultimately lead us all in our respective communities towards herd immunity. There is a vaccine working group comprised of people from the diaspora and the stakeholders in Armenia at the Ministry of Health, at the National Institutes of Health, and a couple of the hospitals and clinics. So that vaccine working group will they have to determine, first of all, which vaccine they will take. They're waiting to get, they probably will not be recipients of the mRNA platform from Pfizer and Moderna. They most likely will be receiving through the WHO, COVAX Alliance, and it's not clear yet which of those vaccines will become available to them. Once that's available to them, then it's incumbent upon us as well to help sort through the data in such a way that we can communicate whether it is safe and efficacious for the Armenian population to take. And then again, anybody who is part of any NGO there will need to utilize that health communication to try to get their most vulnerable in their communities to become vaccinated.
And is there a sense of when that might begin?
So there's a lot of sense of that here in the United States. There's a much less a sense of that in Armenia, much less a sense of that in Armenia, in part because of the issue of distribution, resources, purchases, and things like that. But my fervent hope is that it will happen by the summer of 2021. As many of you who are on the call know, Armenia generates much of its revenue from tourist industry and particularly tourism from the diaspora. And there are many of us on this call who would like to be there helping out were it not for some of these other risks. And so it's my fervent hope that this will be something taken in as fast a fashion as can happen safely and effectively. And my hope is that it'll be by summer of 2021.
So a lot of non-vaccination preventive measures need to be taken between now and then.
Yeah, it's going to be a really tough winter, and I just hope that we can support healthcare workers to be able to do the work that they're doing. It's really heroic. I hope that people, it's so complicated in Armenia. It's not like people can really isolate. There's multi-generation apartments. It's a tough challenge, and one that we should be collecting data on as well, because we can sort of figure out if there are some interventions that are more effective than others. And then that information could be helpful for the next population that goes through conflict during a pandemic as well.
Just one more question or related to this. In the past, how has vaccination been received in general in Armenia? Has it been generally accepted? Has there been a higher level of resistance in Armenia as opposed to other places that you're aware of?
So for pediatric vaccines that were in existence or that generally existed during the Soviet years, so some of the very important and required vaccines, for example, here is required as well, childhood vaccines, there's good coverage. And really what's also good to know is that there's a good distribution system. So for childhood vaccines, I think there's ample evidence to show that Armenia would be well poised to distribute a childhood vaccine, but children are not going to be in the priority list. And this is a vaccine that's really aimed at older adults in particular, and adults that have other comorbidities. And I would say that in that area, the jury's out. There's not nearly as much evidence to show that there's effective distribution of vaccine for adults in Armenia, simply because there haven't been that many. So there is a flu vaccine, and just like here in the United States and everywhere in the world, that's also tough to get maximum distribution of vaccine as well. People feel it's the flu, I'll just get the flu, or they feel that the flu vaccine somehow could pose a danger to them, which is not the case. So I think that that's an added layer of challenge. And again, one where academic institutions and researchers and our public health working group and people on the ground at the American University of Armenia School of Public Health all need to try to gather as much formative information as we can to know what are the resistance points going to be, and maybe we can create successful health communication campaigns or policies through the government institutions, schools, things like that, that we can try to anticipate the resistance that will be out there and work on that before we get the vaccine.
Wow. Okay. Thank you. And thank you for those excellent questions from the audience members as well. Khachik, any last words from you?
I'm good, thank you. I think Kim's response, I can't add anything to it. I did have a half-serious comment, though, when it came to creating awareness in Armenia. In the news today here, we read that, 3 former presidents have expressed willingness in the United States to take the vaccine publicly to encourage people. So perhaps, former presidents of Armenia and the current leaders perhaps can play that kind of role in the case of Armenia as well, because it is a major concern to really think about, again, how many people are going to be willing to take the vaccine when it becomes available to many of these countries that unfortunately, it seems from what's out there, that will only start receiving the vaccine in the second half of this year.
Right.
Well, then thank you, Kim. Thank you, Khachik, and thank you in absentia, Sion, for your contributions to the discussion tonight. It's a very serious couple of serious matters that come together here, and it's been very informative for me, and I'm sure it's been very informative for everybody who's been listening. So thank you so much on behalf of all of the co-sponsors and organizers of the program tonight, and we will see you next time. Good night.
Good night. Thank you so much. Thank you.